everybody, welcome. It's Dr. Brown from Canis Chiropractic, your Baltimore area chiropractor. Today I'm going to show you how we adjust a patient that is really pregnant. How far along are you?
39 weeks.
Okay, so kind of tell them what brought you in here and that type of thing.
So I had sciatica pain, lower back pain. The sciatica pain was pretty relentless and I couldn't walk. My legs were giving out, so I started getting adjusted, and every adjustment, things got better and better.
Sciatica, for people that don't know that, and happens to a ton of pregnant people, is pain that goes down your leg. Goes down your leg, your nerves from your low back, come off of your low back, go down your legs. As things get pinched, it puts pressure on there. So that's what brought her in here. And we've been adjusting her for the last 6 months or so, trying to keep everything balanced, keep everything maintained. As you're pregnant, hormones are released, which causes the ligaments to relax. Things get a little unstable. Here's what happens. As you get pregnant, your belly goes out. When your belly goes out, your back goes into extension. That means it starts to get compressed. So that's why you start to develop pain down your leg. You start to your hips get off kilter. So what we've been doing is we've been stretching her out, trying to open up the back of the joint, open up that area where the nerves come out. I'll show you how we do that. And then we've been adjusting her with our hands to balance out the hips and the pelvis. So we have a special table here. This is used for pregnant people, so you can lay on your stomach. Can you see this right? Mm-hmm. And what happens is this drops down so patients can lay down. And we see a lot of pregnant people because you can't take medicine when you're pregnant, or you're not supposed to. So we get a lot of referrals to our office to help pregnant people, to help them with their pain and their discomfort. So she's going to be able to lay on her stomach, lay down, and we'll figure this out. All right, so the first thing I'm going to do, Laura, is I'm going to stretch her out. And we do this with a treatment which is called flexion distraction. So this is going to help to stretch her, and this is going to help to separate the joints in her low back. She feels bad because it's being squashed together. Your belly goes out, your back gets squashed. This is going to help to unsquash it. So let's stretch this out, and this is going to feel good for her. So what this is going to do, this table is going to separate here. She's going to hold on up here, hold on there, Laura. And this is going to pull apart. You can see how the table separates. As this separates, this stretches out her low back. Does that feel good?
Oh, it feels awesome.
It stretches out the disc space, takes the pressure off of the back of the nerve. So then we're going to flex this table down, which is going to help to open up the back of the joint. So she feels bad because it's being compressed. So what I'm doing is this supporting those vertebrae in the low back, and this stretches it. And it feels very, very relieving, doesn't it?
Oh, it feels great.
Right.
It's
so,
like a total release.
Yeah, and that feels really good to especially a person who's pregnant. Just really opens up the back of the joint. We also do this treatment for people that have disc problems, people that have disc bulges, disc herniations. Great treatment because what it's doing is decompressing the back of the spine, decompressing the back of the joints. And this feels really good. You feel that, right?
Uh-huh.
And it just takes a ton of pressure. And then after we do this, we're going to give her a manual adjustment in her low back, which will help to get the pressure off of the hips and off of the pelvis. The main thing is that we've just been trying over the last 6 months or so to try to keep the pressure off of there, keep her functioning. We don't want her to be bedridden, which unfortunately happens to a lot of pregnant people, especially if their pain gets out of control. And she can't afford to do that because she's got another baby at home. How old's your?
2 years old.
Right. So, and she's constantly lifting, which also puts strain on the low back. So we've been doing a pretty good job of maintaining and kind of keeping her pain under control, right?
Oh, absolutely.
Good. Does that feel good?
It feels great.
Okay, now I'm going to take the table over to the sides too, which is going to open up these joints in the low back. Open up the what's called the facet joints, where the joints rest on top of one another. Does that feel good?
Mm-hmm.
And this feels very relieving.
These are like my favorites.
So we'll do this, and then after this, she goes on this table. It's a roller type of table. It helps to massage these muscles, helps to traction out the joints. And it helps to get a little stability with the special table that we have, just to keep her kind of in balance here. And after we do this, we will adjust her hips and her pelvis. Feel good?
Yep.
So So any pregnant people out there that are suffering, you don't have to suffer. Okay. So. All right, that's good. So that's that. I'm gonna lock the table in, and what we're gonna do is this. I'm gonna push this table together, and then what she's gonna do, I'm gonna adjust her mid-back first. I don't know, can you see it's kind of cramped in here? So we're gonna adjust her mid-back. She's tight. This area is tight. This area has been compressed. This area gets irritated. These muscles and these joints have to work extra hard. When they work extra hard, they get tight. So we want to make sure everything stays loose. We want her to have a nice, easy pregnancy, which she's going to be delivering, what, next week?
Yep.
All right. So take a deep breath in. I'm going to push down gently. Blow it all the way out. This is going to get some mobility into the mid-back. Good. Now what she's going to do is she's going to push up here and lay on your side. Okay. You might have to go on that side, right?
I got my.
Okay. And I'm going to show you how we're just going to adjust her hips and her pelvis. So grab your elbows. And, okay. Just kind of relax. Let your hips twist. Good. And that shifts that back into position. Lay on your other side. Good?
Yep. I just get a little tense.
I know. Just grab your elbows and just kind of just let your back relax. We're going to adjust this pelvis, side of the pelvis. Good. It's tight, but everything
feels
moves.
awesome.
But she's going to be tight because she's due next week.
Pretty
so
pregnant.
good, right?
Yeah, it feels
Everything
great.
feel good?
Yeah.
What does it feel like to be
To
stretched?
be honest, the stretching's the best. I mean, you feel like that total release, like immediately. And then you just feel like less tension. And then obviously being adjusted is a home run.
Good, so that's good. So, and that's what we want to do. We want to keep the pressure off. All right, I hope everybody enjoyed the video. Please subscribe to my YouTube channel. Remember, pain's not a lifestyle, and we'll see you next week for another video. Thanks.